If you're considering all-on-4 dental implants, this issue probably affects you. Did you know that up to 60% of patients who go for all-on-4 implants have a hidden sinus issue that could cause their implants to fail just a few years later? In today's video, we're going to tackle exactly what that is: large forward-drifting sinuses. Hey everyone, I'm Dr. Daniel Choi, board-certified periodontist since 2011 here at North Texas Dental Surgery. If your sinuses drift too far forward, it can drastically affect how and where we place implants, especially for full arch solutions like All-on-4. Before we get started, I want to let you know I've prepared a free PDF that outlines how to spot sinus-related risks and avoid excessive cantilevers in your implant treatment. Also, the free PDF gives you questions to ask and what to look out for. Just follow the link in the description below to sign up and get it delivered straight to your email. And don't forget to watch until the end, because I've got a crucial piece of advice that could save you thousands of dollars and years of frustration. Let's dive in. So in a recent consultation, I showed a patient an x-ray revealing her sinuses weren't just sitting above the molars. They extended all the way forward towards the first premolar region. That drastically reduces the space we have for placing implants in the back of the upper jaw, exactly where we need support for a full arch restoration. If you're dealing with something similar, you're at risk for issues like cantilevers and ultimately implant failure if not addressed correctly. For all-on-4 or all-on-X procedures, we commonly anchor implants around the first molar to second premolar region. But when sinuses drift forward, the bone in that area becomes pneumatized. Basically, the sinus cavity eats into what used to be solid bone. So what's the result? Number 1, reduced bone for implant support. We simply can't place the implant where we ideally want to without risking poor stability. Number 2, increased risk of cantilevers. If we end up placing your implants too far forward, there's going to be a bridge of prosthetic teeth hanging behind them, known as a cantilever. Cantilevers dramatically boost stress on the implants and can lead to prosthetic failure or hardware fractures down the road. A cantilever is when the back teeth in your restoration aren't supported by an implant directly underneath. The longer that span, the more torque or bending force on each implant. When your sinuses drift too far forward, it becomes impossible to place implants far back enough to support the last molar. That extra leverage translates to several issues. Number 1, loosening or fracture of the implant prosthesis. Number 2, bone loss around the implants. Number 3, higher risk of implant failure, including broken multi-unit abutment screws. This is why precise implant positioning in the upper jaw is crucial, especially in full arch solutions. Luckily, large forward drifting sinuses don't mean you're out of options. Here are some approaches to fix the problem. Number 1, sinus lifts, either lateral or crestal approach. So in this procedure, we lift the sinus membrane and place bone graft material to reclaim lost vertical height. One caveat is that it can take about 5 to 6 months to heal before we can actually load an implant. Number 2, we have the option of pterygoid implants. These are placed in the far back region of the upper jaw, bypassing the sinus. However, it demands high surgical skill since there's risk of serious complications like hemorrhaging. And number 3, we have another exotic option called zygomatic implants, where they are anchored into the cheekbone, which is called the zygoma, and they're a last resort option for severe cases. While they can be lifesavers, they also can carry increased risks if complications arise. So let me share a quick story. My patient Bill came in from Vegas wanting all-on-4. He was a heavy smoker with severe infections and a forward drifting sinus on his right side. After reviewing his 3D scan, I informed him that in order to get rid of his upper cantilever, we would need to do a lateral window sinus lift on his right side. So that's what we did. We did 4 implants in the usual positions and 1 further back on his right side, along with a simultaneous lateral window sinus lift. This setup minimized the cantilever length, giving him strong back molar support and a much more secure final prosthesis. If you've been told that you have forward drifting sinuses or a large cantilever is unavoidable, seek out an experienced surgeon who can handle complex cases. We use 3D imaging to visualize bone availability, sinus position, and potential implant pass, reducing the risk of complications during surgery. Now let's talk about that crucial piece of advice I mentioned at the start. Make sure that your surgeon is comfortable with all the techniques, meaning sinus lifts, pterygoid implants, and zygomatic implants. Earlier in my career, I relied on sinus lifts to avoid pterygoid or zygomatic options. But after doing thousands of all-on-4 arches, I've seen how suddenly a plan can change mid-surgery. Bone quality might be worse than expected, or other unforeseen complications might arise. Having the ability to pivot is essential to saving a case if something goes wrong. Large forward drifting sinuses can be a real challenge, but with the right approach, whether it's sinus lifts, pterygoid implants, or zygomatic implants, we can avoid these excessive cantilevers and drastically lower your risk of implant failure. If you suspect sinus issues might complicate your implants, reach out to us at North Texas Dental Surgery for a thorough evaluation. And remember to sign up for the free PDF in the description below to get a deeper dive on forward drifting sinuses and how to plan your All-on-4 properly. If this video helped you, hit like, subscribe, and share it with anyone who might benefit. I'm Dr. Daniel Choi, and I'll see you next time. Remember, taking the right steps now can save you years of trouble down the road. Thanks.